Welcome to the First Aid Show Daily Minute Podcast, your daily dose of first aid, brought to you by Australia's first and only first aid conference and exhibition, the First Aid Show.
Your patient is pale, sweating and confused. They have diabetes and their blood glucose is 2.8. You have glucose tablets and a tube of glucose gel in your first aid kit, and someone hands you a can of Coke. Which should you use? How do they work? And when shouldn't you give them? Today, we're looking at oral glucose. Oral glucose is the over-the-counter medication used to treat hypoglycemia, low blood sugar, which occurs when blood sugar levels fall dangerously low. Glucose, also known as dextrose, is the body's preferred source of energy and is particularly important for the brain. Oral glucose commonly comes in two forms, glucose gel and glucose tablets. Glucose gel is usually supplied in a single-use tube containing approximately 15 grams of glucose. Glucose tablets are chewable tablets with each tablet containing around 4 grams of glucose. The purpose of oral glucose is simple, to rapidly increase blood glucose levels and relieve the symptoms of hypoglycemia. Symptoms may include sweating, shaking, hunger, confusion, weakness, dizziness, and changes in behaviour. If you want to know more, head back to our episode on diabetes, hypoglycemia. Glucose tablets are chewed and swallowed, allowing glucose to be absorbed through the gastrointestinal tract. Glucose gel may be swallowed directly or briefly held into the mouth before swallowing. Now, for many years it was believed that glucose gel was significantly absorbed through the tissues of the mouth. However, studies have demonstrated really poor absorption through the oral mucosa and concluded that oral glucose gels have their therapeutic effect primarily after being swallowed and absorbed through the GI tract. The indications for oral glucose are conscious patients with suspected or confirmed hypoglycemia who can safely swallow and follow instructions. One commonly taught approach is the 15-15 rule. Give approximately 15 grams of fast-acting carbohydrates and wait 15 minutes. Then assess the patient's blood glucose level if the blood sugar remains low. Treatment may be repeated according to your clinical practice guidelines. Now, the main contraindication to oral glucose is a patient that is unable to swallow safely, because oral glucose shouldn't be given to an unconscious patient, someone having a seizure, or anyone in an altered conscious state, because they can't protect their own airway, and giving glucose by mouth in these situations will compromise that airway and create a choking risk. Glucose tablets and gels offer several advantages. They provide a predictable dose and are easy to carry, and reduce the risk of over or undercorrecting blood sugar levels compared to soft drinks, confectionery, or other sugary foods. So whether you use glucose gel or glucose tablets, remember the 5 rights of medication administration and always treat the patient, not just the number. Because when the brain runs low on fuel, sometimes a few grams of glucose can make all the difference.
Thanks for tuning in to the First Aid Show Daily Minute Podcast. Don't forget to like, subscribe, leave a review, and follow us on social media for more first aid tips and updates. Until tomorrow, stay ready, stay confident, because a prepared first aider saves lives.
Welcome to your Daily Minute.